My name is Caitlin Winn, Caitlinwinn. I have my work badge as I don't have a Seneca 1 badge. I'm going to do a 360 of the room. I am using a tripod to record. Hi, how are you?
Good, thank you. How are you?
Good. Are you having any chest pain?
I have an ache in my upper chest.
Any shortness of breath?
I don't think so.
Any palpitations?
No.
Are you having any abdominal pain?
I have a stomach ache and I have pain right in the middle here.
Okay. Any nausea or vomiting?
I am nauseous and I did vomit once.
Okay. Any palpitations?
No.
Any cardiac history that I need to be aware of?
I take a pill for my cholesterol and my blood pressure is high.
Okay. And any alcohol use?
No. Oh, a glass of wine with dinner sometimes.
Okay. I would then go on to do my pain assessment, which would be my OPQRSTU. I'm going to auscultate the patient's chest. Is it okay if I listen to your chest?
Yes, thank you.
I'm going to auscultate 5 points, which would be your aortic, pulmonic, herbs, tricuspid, and mitral. I would also listen a second time with the bell of my stethoscope to listen for any murmurs. I would also do a check of the patient's pulse points. So we do carotid, the brachial, radial, femoral, and pedal pulses. I would also check the patient's capillary refill. It's less than 2 seconds within normal. I would also identify the lower legs for any swelling or edema. For my abdominal assessment, I would obviously look at the abdomen. There's no bruising, everything looks symmetrical, there's no signs of distension. I'm going to auscultate prior to any palpation so that I can get a proper and accurate reading of their bowel sounds. So I would start in the right lower quadrant, which would be their appendix, the right upper, which is the liver and gallbladder, the left upper, which is the stomach and spleen, and the left lower, which is the descending colon. On palpation, I would use 3 to 4 fingers, 1 to 2 centimeters deep. I'm not going to actually palpate my patient's stomach if she is pregnant. So I would start in the right lower, to the upper, to the left upper, and the left lower. The patient looks well. There's no signs of diaphoresis. There is no shortness of breath on exertion when they walked into the room. There's also no shortness of breath or increased work of breathing at rest. The vital signs of the patient were a heart rate of 105 and regular, but this is not a normal value. The blood pressure was 167/100, which is also not normal. Rest rate of 20, which is within normal limits, and a temperature of 37, which is within normal limits. Going forward, I would think that the 63-year-old patient that presented this morning after breakfast with symptoms, complaining of 8 out of 10 pain, complaining of abdominal discomfort with mild chest discomfort and shoulder pain. At this point, I would suspect that the patient is having an MI, which is a heart attack. Tests that I think the nurse practitioner or MD could order would be a ECG, blood work including troponin, possibly CK, possibly even an abdominal ultrasound. They could also possibly do an echo, place the patient on cardiac monitoring, and go from there. Thank you.